So this is just a quick video about promoting breastfeeding, but it's also talking about how do I know my baby's getting enough and what are some initial steps you can do if the baby isn't breastfeeding well. So the whole topic of breastfeeding is big, but this is sort of just an introduction. So in terms of the advantages of breastfeeding, it's for the woman, it's practical, it's easy, it's already mixed up, it's economical, you don't have to pay for it. It also provides some contraception because your body doesn't want you to both breastfeed a baby and grow a new baby in terms of another pregnancy. And it has been shown to decrease postpartum depression and decrease the risk for the woman over her lifetime of breast and ovarian cancer, as well as decrease her risk of osteoporosis, so the fragile bones that older women get. For the baby, it's better nutrition than bottle feeding. It has immunity, so it has immunoglobulins like the or antibodies that the woman makes for herself, and she gives it to the baby through her milk. It also decreases the risk of sudden infant death syndrome and the baby's lifetime risk. It decreases the risk of type 1 and type 2 diabetes as well as obesity. So we want to have this discussion about what her plans are prenatally, and we don't want to, miss an opportunity to sort of provide her information and not just leave it for a brief discussion at the birth. So you want to discuss these benefits of breastfeeding, and basically from the World Health Organization's viewpoint, so they advise healthcare providers and policymakers around the world. Their stand is that it's beneficial for the child if the woman breastfeeds for the first 2 years of life, introducing solids at 6 months. But from 0 to 6 months, the baby is exclusively breastfed. So that's sort of an ideal. And then, everybody's lives are weird and upside down. So, the idea is to also talk about if a woman does want to breastfeed, what kind of supports in place will she need so that she can rest, make milk, and feed her baby. You also want to be frank and have an open discussion with the woman about concerns she might have about breastfeeding. So she might be concerned about whether or not she can drink alcohol after the birth or whether or not she can smoke pot. So my understanding for alcohol and for pot, I'm less sure, but my understanding for alcohol is that your blood level of alcohol is also your breast milk level of alcohol. So whatever's in your blood is in your breast milk. So if you're drinking alcohol and you're drunk and your blood alcohol is high enough, then that milk also has alcohol in it and is probably too high to feed the baby. Is definitely too high to feed the baby. So if you're planning to go out, a good strategy would be to pump milk and then feed the baby with that milk, but you've gone out and now while you're drinking, you would discard any milk that you have until you're sober again. I think that's the same for THC. Basically, if you're buzzed, then that buzz is in the breast milk as well. And for a little brain of a baby that's developing, it's probably good to avoid feeding the baby those bottles of or those feeds of breast milk. So we want to encourage the baby to breastfeed in the first hour after the birth. So in that first hour after the birth, the baby is very alert. In a normal birth with a normal baby, the baby's alert, and there's this window of learning that happens that really imprints upon the baby. It gives the baby an opportunity to do that initial bonding with the mother that we talk about. But all of that kind of coordinated sucking and swallowing, the baby is really open to learn in that first hour. It doesn't mean that if that doesn't happen, breastfeeding is all lost. No. If the baby needs any help breathing, we look after that first. But we also we can also overcome that. But if everything is fine after the birth, get breastfeeding started. And that's one really big step off to getting a very successful breastfeeding situation going. So you want to know that there are signs of breastfeeding is going well. So this is something you can explain to the mother as well as in your own assessment of the baby. So she wants to know that everything's going well and she should continue, and in case she's discouraged, you can show her that these are the things that we're looking for. So in the first 24 hours, the baby has time to learn how to feed. So we're not so concerned about getting in any sort of number of feeds in the first 24 hours. That's for a normal baby. So after that first 24 hours, then we want to see 8 or more feeds a day. So we don't want to see the baby feeding all the time because that means the feeds aren't being effective and the baby's not getting enough. We also don't want to see less than 8 feeds because the baby wouldn't be able to get in enough calories throughout the day. So if the baby's feeding every 2 hours, and then there's this one stretch where the baby does 6 hours without feeding, that's fine, as long as the baby is getting in 8 or more feeds. Another baby might feed on the clock every 3 hours, and there's no long stretch of delay because in order to get in those 8 feeds, the baby has to feed every 3 hours. So every 2 to 3 hours is what you'd expect, with no longer period of a 6-hour stretch, as long as the baby's getting in those 8 feeds. You also want to see 6 Ps a day. So in the first 24 hours, we want to see 1 P. In the second day of life, you want to see 2 Ps. Third day of life, 3 Ps. By 4 days, after 4 days, you want to see 6 Ps. Really good soaking wet diapers. That's a baby that's thriving. As well, you want to see 1 or more poos a day. And those poos are going to transition from meconium to transitional stool, which is green. So the transitional poo or stool, you'll hear the word. And then if, as her milk's coming in and that heavy fatty milk comes in, then the poo will change to yellow. And it'll continue on for yellow as long as the baby's breastfeeding. You want to see good tone. So the baby shouldn't feel like a wet noodle. So even when the baby's sleeping and the baby grasps your finger, there's a little bit of strength there. The baby doesn't feel like a piece of overcooked lasagna. So you also want the baby alert. So after a feed, sure, the baby's going to conk out, really have a great sleep, but then the baby's going to wake up, want to initiate another feed. It's going to have maybe after the first day or two have these quiet alert periods. That's also a good sign. The baby's going to regain their birth weight because they lose a bit of weight as the milk's coming in. So they'll regain their birth weight by 3 weeks. This is actually a bit, stretching it. You would want to see a baby regain birth weight by 2 weeks and then start acting to ensure that the baby regains birth weight by 3 weeks. But a baby that's on its way to regaining birth weight is another sign that breastfeeding is going well. As well, a baby gains more than 15 grams a day. 15 grams a day is acceptable, but that's not a baby who's thriving. You'd like to see a lot more than that, but you can say 15 grams a day is acceptable. Signs that breastfeeding is not going well is that in the first few days of life, the baby loses 10% of their birth weight, and they're not regaining their birth weight by 3 weeks of age. You also see that they're not gaining well. So it's like less than 100 grams a week in the first month. If there's meconium present on day 5, that's very suspicious about how the baby's feeding. Is the baby getting to that heavy fatty milk near the end of the feed? Is the mother producing enough milk? Also, if the baby's lethargic, so they feel like a wet noodle, they have a weak suck, or they're sleeping for greater than 6 hours before 6 weeks of age. So they're conking out and they're just not waking themselves up. The mother has to wake the baby up. If the woman's having delayed milk coming in, or if there's decreased milk production for any reason, if she has health risks or she's not being well supported, or you may need to be supplementing the baby in order for them to meet that kind of minimum weight gain a day. So those are signs that breastfeeding needs to be supported and the baby needs to be monitored closely. So you can't do the routine visit of just sort of, every couple of days and then later on every couple of weeks. It's really, you're going to be following that baby closely. So some of the causes of the baby not or the breastfeeding not going well is that the baby's not feeding enough. There's a couple types. So one is that, I call it the baby's content to starve themselves. So they wake up, they feed a little bit, it takes the edge off. They don't feel that hunger pain, they go to sleep, but they didn't fill their belly, they didn't empty the breast. If they're not emptying the breast because of the poor latch or a poor suck, or they're just not very aggressive feeding, the woman's milk supply isn't going to increase to match the baby's needs. So if a baby is, say, 3,000 grams at birth, like a 3 kilo baby, when the baby's born, the mother's breasts don't know that. So the baby has to tell the woman by sucking on her nipple, and then that sends a message to her brain that I'm 3 kilos, you need to make this much milk. If the baby's having a short time at the breast, if the baby's not latching well and there's a weak suck, the message that the body's getting is the baby's only 1 kilo. And so she's not going to produce very much milk. So the baby needs to be at the breast sending a message, how much milk do I need? And how much do you need to be producing as I grow? Also, there's some medications, some can sneak up on you. One is pseudoephedrine, which is like Sinutab. It can reduce your milk supply, as well as oral contraceptive pills. Even the progesterone only pill could be suspect if you're trying to look at all things. Maternal diet, fatigue, stress, of course, maternal illness, and baby illness. So you're going to use all of those things when you're assessing the mother and the baby, and how to help her and support her breastfeed so her baby can thrive. In terms of management, you just kind of go down this thing. So you're assessing and correcting the latch. So you need the baby to have a wide open mouth, and the jaw of the baby is milking the breast. So if the baby's just on the nipple, that message to the brain telling the mother, how much do I weigh, how much milk do I need, is not being sent. So the baby has to be on the whole areola. And then the nipple is safely in the back of the mouth of the baby, in the soft palate, not getting like mashed, and we're not going to have the woman hurt her nipples. So you want to see a wide open mouth, the baby latches on, and the baby's milking the breast. You can also demonstrate breast compression, and I do this anyways. Like if the woman is busy, for me, it just saved me in my second baby, where you had a baby who's interested in eating a lot. Great. Well, you've got this much time to get it done, because I also have a toddler. So you can show breast compression, where you're kind of milking the breast of those 25 ducts that are around the whole breast, and helping her milk the breast into the baby's mouth when the baby has slows down the feed. And then she's going to refill the breast for the next feed. She could also be pumping after a feed for a baby that's not particularly aggressive, and top up afterwards with the milk that she's pumped off. Maybe discontinue a soother. Maybe the baby's kind of wanting more milk, but is getting a soother instead of being fed. And also, you could be considering supplementing after a feed. So you can top up at the breast, so the baby's still stimulating the breast, but you use a little tube at the breast so the baby's getting calories while feeding. So calories from both the formula and milk from the mother. In the case where you're assessing a baby that's not thriving, you're thinking of three things. So one is the milk, the transfer. So looking at management, we're like, is the baby latched on? Then we're looking at production. Is the woman making enough milk? And then we're looking at, does the baby have something wrong with it? So even after supplementing with formula at the breast, the baby's getting milk from the breast, the baby's getting formula, and the baby's still not gaining weight, then you have a problem. Now we're thinking there's something wrong with the baby, that the baby can't thrive, maybe malabsorption of food, or maybe something organic going on, and that needs a medical consult. That's why if by 2 weeks you're still concerned, like this doesn't seem to fit your picture, you don't need to wait to 3 weeks to regain birth weight. You can consult before that. But your three things is, can the baby get the milk? That's the transfer. Is there milk there for the baby? That's the production. And finally, is there something going on? Even when we stuff the baby doesn't gain weight. That's unusual. So in terms of medication option, just for increasing milk supply, there's these herbal remedies that are really quite effective, even though I tend not to always recommend herbal remedies, but fenugreek and blessed thistle together, 3 capsules 3 times a day. And then the other one is domperidone. So this is really for used off label. So it wasn't invented for this purpose, but it does increase milk supply. And there's a prescription there. If it's well tolerated, you just keep taking more and more of it. And you're trying to get the right amount of medication to match the needs for the milk supply.